So we've got the psychology and the way that those things roll. That goes into a good result and a good case. And then you have aesthetics, right? So then the prototyping, that starts with my initial records. I've got to kind of get it somewhere in the right ballpark when I'm doing the surgery. And then we pass that on to the prototype. And so what are the things that you see that go into overall kind of like how the aesthetics play out with Dr. Lax's role and the restorative dentist? I don't mean to just say Dr. Lax with Tampa as well. But what are the things that you see? Do you see a lot of people making a lot of changes? Like what goes into making a good result aesthetic, right? So there's some, let's just kind of speak in generalities. There's the 87-year-old that doesn't care that we still have to tweak in. That we have to convince needs to be tweaked in, and then there's the 35-year-old who wants female that wants 97 more visits. Like what makes that a good result, start to finish?
I think the patient just being open to what their goals are. I think some patients, it's harder to express like what needs to be changed because as you know, like in the restorative team knows on either office, like there's a lot of changes we can do to get them to their goal, their smile goal, I guess a good smile design goal. But it's them just being open about maybe I don't like this design or maybe, I think not everybody, but some patients that are harder to get to that point maybe hold that in or don't know how to express that. So I think patients being open, we're not here to get upset if, they don't like the first PTI or whatever it might be. So just conversation with the restorative team. Yes, there's always two ways. It's a patient that comes in that like you said, we're fighting to make their bite, better and forcing them to have another try-in, not forcing, but, suggesting and them just happy with the first set. And then there's the other side of it where patient who may be a little younger, who may be a little bit in a more vulnerable position of like, wanting it to be perfection. So and we
can cater to all of them. It's just that's something that goes into the experience and the result and how everyone's situations flow. And again, we kind of end up on openness, right? And not putting up a wall and communication. Probably part of that too is sometimes when they come in with the pictures, not that we dissuade people from coming in with pictures. Pictures can be great as an ideal, but sometimes you'll have a patient come in with something from when they were 17, right? And now they're 67 and they don't look like their picture and they'll want that exact face back. Well, I can get you the smile, but I can't get you the face. I don't have that power. So being open to saying seeing yes, those are the shape of my teeth. My lips don't really fall the same way or something like that.
Exactly. I think that's all stuff that like a good restorative team will, and they'll guide you. And a lot of patients actually come in and they're like, hey, you guys are the professionals. You know what you're doing. You know what you're looking for. On our end and, the restorative team will come in here and speak more on that side of it. But I always hear them say, like, functionality is number one. We want to make sure that you can function in these teeth. And then number two, we want to obviously make sure that you
might come in functioning on a tooth, but then they leave functioning on teeth.
There you go. Thanks for the save. But we want to make, functionality number one. Number two, aesthetics, of course, like we want you to love your teeth and to be crying and head over heels in love. And I would say 99.9% of patients always are.